My name is Dr. Rodriguez. I am a weight loss doctor in weightrx.org. Did you know that improved heart health? Reducing the risk of heart disease and hypertension. Weight loss has a profound impact on heart health, significantly reducing the risk of heart disease and hypertension. This connection between weight and cardiovascular health is well documented in medical research, highlighting how excess body weight strains the heart, raises blood pressure, and increases the likelihood of developing conditions like coronary artery disease, CAD, heart failure, and stroke. Here's a detailed explanation of how weight loss contributes to improved heart health. 1. Reduction in blood pressure. One of the primary ways weight loss improves heart health is by lowering blood pressure. Hypertension, or high blood pressure, is a leading risk factor for heart disease. Excess weight, especially around the abdomen, increases the workload on the heart. As body weight increases, so does the volume of blood circulating through the body, which in turn raises the pressure on artery walls. This elevated blood pressure forces the heart to work harder to pump blood, leading to the thickening of the heart muscle, particularly the left ventricle, which can eventually lead to heart failure. Losing weight helps to reduce the strain on the heart. Even a modest weight loss of 5 to 10% of total body weight can lead to significant reductions in blood pressure. As the body loses fat, particularly visceral fat, the fat stored around internal organs, blood vessels can expand more easily, improving blood flow and reducing the overall pressure within the cardiovascular system. This decrease in blood pressure lowers the risk of damage to the heart and blood vessels, thus reducing the likelihood of heart disease. 2. Improvement in cholesterol levels. Weight loss also positively impacts cholesterol levels, which is another critical factor in heart health. Obesity is often associated with dyslipidemia, a condition characterized by unhealthy levels of lipids, fats, in the blood, including high levels of low-density lipoprotein, LDL, cholesterol, low levels of high-density lipoprotein, HDL, cholesterol, and high triglycerides. High LDL cholesterol, known as bad cholesterol, can lead to the buildup of fatty deposits in the arteries, known as atherosclerosis. This condition narrows the arteries, restricting blood flow to the heart and increasing the risk of heart attack and stroke. Losing weight helps to lower LDL cholesterol and triglyceride levels while raising HDL cholesterol, often referred to as good cholesterol. This shift in lipid profiles reduces the risk of plaque buildup in the arteries, thereby decreasing the chances of coronary artery disease. Regular physical activity, often a component of weight loss programs, further enhances these effects by increasing HDL cholesterol levels and improving overall cardiovascular health. 3. Decrease in inflammation. Chronic inflammation is a significant contributor to heart disease, and obesity is closely linked to increased levels of inflammation in the body. Fat tissue, particularly visceral fat, releases inflammatory substances known as cytokines, which can lead to the development of atherosclerosis, the hardening, and narrowing of the arteries. Inflammation also contributes to insulin resistance, another risk factor for cardiovascular disease. Weight loss reduces the amount of fat tissue in the body, leading to a decrease in the production of inflammatory cytokines. This reduction in inflammation helps protect the arteries from damage and lowers the risk of heart disease. Additionally, weight loss improves insulin sensitivity, which not only reduces the risk of diabetes, but also diminishes the inflammatory processes that contribute to heart disease. 4. Reduction in heart disease risk factors. Beyond lowering blood pressure, cholesterol, and inflammation, weight loss directly impacts several other risk factors for heart disease. For instance, weight loss can improve endothelial function, the ability of the arteries to dilate and contract efficiently. Poor endothelial function is an early indicator of atherosclerosis and heart disease. Weight loss, particularly through regular physical activity, enhances endothelial function, promoting better blood flow and reducing the risk of cardiovascular events. Moreover, weight loss can help in managing other conditions that contribute to heart disease, such as sleep apnea and metabolic syndrome. Obstructive sleep apnea, common in individuals with obesity, is associated with high blood pressure and an increased risk of heart disease. Weight loss often leads to improvements in sleep apnea, which in turn...
Schedule now. weightrx.org, #1 online weight loss clinic in the United States.